Hello and welcome to Introduction to Arterial Lines for the Delivery Suite. My name is Kevin Rafferty, one of the anaesthetic regs currently working in Craigavon and Daisy Hill. Today we'll go through the common issues surrounding arterial lines in the delivery suite. Why do we need arterial lines in the delivery suite? We have seen them sporadically caring for patients with obstetric hemorrhage. However, recently, due to the COVID-19 pandemic, we're seeing more and more mums now requiring arterial lines for closer respiratory monitoring. I would like to thank our midwifery and obstetric team of the Southern Trust for all their work during the pandemic and this increased workload of the mum-to-be who has COVID. So what is an arterial line? An arterial line is a small cannula usually inserted into the radial artery and through its connection with a specific monitoring tubing can continuously monitor blood pressure. As blood flows past the catheter tip, the pressure generated by that flow is then sensed by a section of the tubing known as a transducer. This transducer conveys the information to the bedside monitor, which converts this into usable or recognizable data. So it'll tell us our systolic, our diastolic blood pressure, and it also tells us our mean arterial pressure. And we can see our wiggly line, our waveform, and we can get our numbers from that. So from the numbers and the nature of this waveform, we can tell a lot of things. Why do we need these arterial lines? These arterial lines can be used in patients with any condition that necessitates continuous or very close blood pressure monitoring. Also, they're useful in the management of respiratory failure to tailor our ventilatory support. With these arterial lines then we can take frequent arterial blood gases, and with these frequent arterial blood gases we get great information about the oxygen within the arterial blood, and this can guide our supplementation of oxygen, and it will also help dictate the future of that patient as to how to best manage them, whether they would require non-invasive or invasive ventilatory support. In order to site arterial lines, they're usually carried out by an anaesthetic doctor, an anaesthetic reg or SHO or consultant. Any anaesthetist that's on the delivery suite would be capable of siting an arterial line. These lines are usually sited in the wrist, the radial artery, as you can see in the photograph here, and it's better that the position of the patient is like this, with the hand out and extended. These lines are frequently, if they're put in, are frequently put in theatre, and usually the arm is out on an arm board. The technique is a sterile technique. We will use sterile gloves, pinafore or full gown, and we'll be wearing a mask and a hat. The technique for siting arterial lines is called a Seldinger technique, and all that really means is that we use a needle, as you can see in the top of the screen, and a wire. Then once we puncture the artery, you can see the arterial bleed. It'll be a pulsatile bleed coming out of that little needle, and then the wire goes into that needle. The needle then gets removed with the wire remaining in situ, and then we pass the catheter with that red tip. It goes over the wire into the radial artery, and then the wire is removed, and then we connect it up to our tubing system, our special arterial line tubing system with the pressure transducer all connected, and hopefully then we'll get a good waveform. Once the arterial line has been sited and we connect it up to the transducer line, we then have the pressure bag inflated, because this column of fluid is under a slight amount of pressure in order to keep everything taut, so that any pulsation then pushes against the transducer and gives us our red wiggly line, as we can see up on the cartoon screen here. It's important to consider where we position the transducer, because this will greatly affect the blood pressure reading that is given. If the transducer is below the level of the heart, you can get an artificially high blood pressure reading on the screen. whereas if you lift the blood pressure transducer, the pressure transducer above the level of the heart, you'll get an artificially low pressure on the screen. Common but not serious issues that can occur with arterial lines. The pressure bag itself can become deflated. Usually there's a little indicator on the specialized pressure bag that tells you the appropriate pressure to fill or to create around that bag, so that there is a constant pressure so that the transducer can act upon that. It's also very important that the fluid that is within the pressurized system is normal saline or 0.9% saline, nothing else. Sometimes we speak about damped traces. That's whenever our wiggly line is sort of less wiggly, so we don't get a very good representation of the top and bottom numbers. These numbers will go more to the mean pressure. Sometimes there's no numbers on the screen, and this may be because there's a disconnection of the cables, or that the set has not been properly zeroed. And what we mean by zeroing the arterial line is that the transducer must be at the level of the heart, and that must be the zero pressure. Because the pressure is relative to where it is above or below the heart, then we need to be zeroed at the level of the heart. Sometimes it's very common for the transducer to fall and give us a very artificially high blood pressure reading, or that the patient may be holding the transducer higher, or it's caught on something to be higher and you make it an artificially low reading. So it's important to ensure the correct positioning at around the level of the heart. Sometimes there can be blood within the line, and that can make the reading incorrect. We usually make it also a damped trace, and it's again also keeping an eye out for disconnection of cables and lines. And these are some issues to give us a call sort of sooner rather than later. We're always happy to come and give assistance with arterial lines, as we know it's not within your routine practice. So if you notice any bleeding, any displacement, any movement of the cannula, if you notice that there's a pale or cold hand, if you notice that the hand has become swollen or swelling around the insertion site, or if the patient themselves complains of new pain or tingling in the arm or hand, we're happy to come round and see the patient and see what's wrong. If there is a profound dislodgement or it just disconnects, then and there's bleeding occurring, compress on the site of bleeding, elevate the arm, and call for us to come and see what we can do about it. This talk was just a brief introduction to arterial lines. I just want to give you some take-home messages. Never ever give drugs or other fluids down the arterial line. We can use the flush that should be normal saline or 0.9% saline, and I would always check that prior to any handover or change of shifts. If at any time you're ever unhappy with anything to do with the arterial line, just please give us a shout. That's why we're here. And again, I'd like to thank everybody for all the extra work and care and attention we're giving our mums to be. Thank you.